Hello, guys. Welcome back to Medico Days. The remaining sessions of Pharmacology 2021 PYQ. A female patient on OZ pills was diagnosed with TB and started on anti-tubercular therapy. She was advised to use an additional barrier method of contraception. What is the reason for this advice? Answer is rifampicin induces OZ pill metabolism and causes the failure of it. So rifampicin is a potent inducer of cytochrome P450 enzyme, accelerating the metabolism of OZ pills, leading to reduced efficacy and contraceptive failure. So all the activators and enzyme inhibitors and enzyme activators are very, very important. Please learn. And CYP450, again, very, very important. Next, a 35-year-old chronic hypertensive patient seeks preconceptional counseling. Which antihypertensive should she discontinue? Answer is AC inhibitors, because they are contraindicated in pregnancy because of the risk of fetal hypoplasia, oligohydramnios, and limb contracture. Also, ARBs are contraindicated in pregnancy. Next question, a pregnant woman was prescribed indomethacin. Which effect does the drug have on the fetus? Answer is premature closure of ductus arteriosus. So indomethacin, which is a non-selective COX inhibitor, causes premature closure of the ductus arteriosus in fetus, leading to pulmonary hypertension. It is used to close a patent ductus arteriosus in premature infants. Next question, which drug is safe for open-angle glaucoma in a patient with bronchial asthma? Answer is latanoprost, which is a prostaglandin F2 alpha analog, which lowers the intraocular pressure by enhancing the uveoscleral flow. It lacks the bronchospasm risk, unlike beta blockers like timolol. Next question, how should alprazolam be used in India? Answer is 0.5 mg daily before bedtime for 7 days. And the how to write a prescription is very, very important, guys. Please learn them. And in prescriptions we use the generic names and avoid abbreviations, and also specify dosing in metric units. Next question, a patient on antihypertensives developed lip and facial edema. Which drug is responsible? So this is a very famous side effect of AC inhibitor. Please learn. It is angioedema, and it is caused via the bradykinin accumulation. So here the example of AC inhibitor is lisinopril. Next question, aspirin induced occult blood in stool is due to the inhibition of. Answer, thromboxane, because aspirin irreversibly inhibits the COX-1, reducing the thromboxane A2, which is a platelet aggregator, leading to bleeding. Next question, which statement is false about managing osteoporosis in a postmenopausal female with T-score of 2.5? So here the answer is bisphosphonates are not given for more than a year, which is a false statement, because bisphosphonates can be given for around 3 to 5 years depending on the fracture risk. It's not like used for 1 year alone. Next question, a patient developed abnormal movements after IV antiemetics. Which drug treats this? Answer is benzoxazole, because metoclopramide or dopamine antagonist causes dystonia or extrapyramidal symptoms. And so benzoxazole is another drug which is an anticholinergic, and it restores the striatal-cholinergic balance, and it is used for motion sickness, serotonin syndrome, or Parkinson's. Here, since the patient is having abnormal movements after IV antiemetics, it is treated with benzoxazole. Next, the dosing rate formula for a drug is based on. Answer, all these formulas very, very important from pharmacology, from physiology, and all the formula related questions. A lot of questions keep coming up. Learn these formulas. Just note them down in a small notebook, and you can revise it on the previous day of your exam, so that it will be there in your mind. So here the answer is clearance into plasma concentration. Next question, a patient on digoxin, clarithromycin, and triamterene developed elevated digoxin levels. Which drug caused this? Answer is clarithromycin, because clarithromycin inhibits the P-glycoprotein, reducing the digoxin excretion and increasing its toxicity. Next question, methotrexate's mechanism in osteosarcoma involves. Answer is competitive inhibitor of dihydrofolate reductase, depleting the tetrahydrofolate and impairing the DNA synthesis. Next question, what should patients on metronidazole avoid? Answer is alcohol, because metronidazole causes a disulfiram-like reaction with alcohol use because of the acetaldehyde accumulation. Next question, a post-nephrectomy CKD patient needs post-operative analgesia. Which is safe? Answer is acetaminophen, because it is least nephrotoxic, unlike other NSAIDs. Next question, a renal insufficiency patient with edema and hypertension should receive. Answer is chlorthalidone, because thiazides, example is chlorthalidone. They are effective in mild to moderate renal insufficiency. Next question, tocilizumab inhibits which interleukin? So monoclonal antibodies, again a very favorite area for NEETPG as well as INICET. INICET, every time, every exam, monoclonal antibody question will be there. Around 2 to 3 questions minimum will be there in INICET. Even for NEET, it is an important area. So guys, since the exam is nowadays going towards the tougher side for the NEETPG, so you can always expect questions from monoclonal antibody as well. So tocilizumab is a monoclonal antibody targeting interleukin 6 receptors, and it is used in rheumatoid arthritis. Moving on to Pharmacology 2022 PYQs. A male patient with chronic obstructive pulmonary disease was prescribed theophylline. He noticed that his urine output has increased the following day. This action of drug is mediated through which receptor? Answer is adenosine A. Theophylline increases the urine output by antagonizing adenosine A1 receptors in the afferent arteriole of the glomeruli. Adenosine A1 activation normally causes vasoconstriction, reducing the GFR and urine output. Antagonism reverses the effect. Next question, which of the following drug is not likely to cause a pleural pathology? Answer is metformin, which is a biguanide. It causes lactic acidosis and GI disturbances, but it doesn't affect the pleura. And another very important drug is bleomycin, which causes pulmonary fibrosis and flagellate dermatosis, and it is an anti-cancer drug. Next question, a patient with deep vein thrombosis was started on a new drug. After 2 days, he presented with purple toe syndrome. Purple toe syndrome, very, very important. It is associated with warfarin. And it is a rare complication, but it is very important from the exam point of view. It is caused by cholesterol microemboli from atheromatous plaques. And warfarin inhibits the vitamin K epoxide reductase, reducing the clotting factor activations, which are vitamin K dependent. Next, a chemotherapy patient developed acute dystonia, bradykinesia, and tremors after taking an antiemetic. Which drug causes this? Answer is metoclopramide. It is a dopamine receptor antagonist, and it's a drug which causes extrapyramidal side effects. So that is why metoclopramide is not always preferred, because of its this major side effect it has. Next question, a weight loss drug inhibiting fat absorption caused easy bruising and increased menstrual bleeding. Which vitamin deficiency is responsible? Answer is vitamin K, which is a fat soluble one, and its absorption is impaired by fat blocking drugs. Example, Orlistat. Next question, a UTI drug causes tendon rupture and arthropathy. What is its mechanism? Answer is DNA gyrase inhibition. So fluoroquinolones inhibit DNA gyrase and topoisomerase 4, causing tendon toxicity. Next question, a digoxin toxic patient with third degree heart block is unstable. What is the next step? Answer is antibody against digoxin. So digibind, that is the digoxin antibody, is used for the life-threatening toxicity which is caused by digoxin. And the mechanism of action of digoxin is by inhibiting the sodium potassium ATPase, and it leads to hyperkalemia and cardiac dysfunction. Next question, an elderly diabetic patient with hyperkalemia. So please learn to identify hyperkalemia and hypokalemia in the ECG is very, very important. Always, it's a very basic question also. Please learn about it. And hyperkalemia patient needs, who is an early diabetic, needs a drug to shift potassium intracellularly. Which is the correct drug to be given? So answer is epinephrine. It activates the beta-2 receptors, increasing the cellular potassium uptake via the cyclic AMP. Next, a pituitary tumor with incomplete resection causes acromegaly. What is the first line management? Answer is octreotide, which is the first line for acromegaly to suppress the growth hormone. Next question, a patient with acromegaly needs a growth hormone receptor antagonist. Which drug? So growth hormone receptor antagonist used in acromegaly, pegvisomant, very, very important. Repeatedly it is coming up, very, very important question. Next question, a diabetic patient with rhinitis and facial swelling has biopsy findings of broad-based aseptate hyphae branching at right angles. Drug of choices, amphotericin B. So mucormycosis is the one which is being mentioned here by the terms like broad, aseptate hyphae and right angle branching. All these are features of mucor. Also learn about the features of aspergillus and which is the drug used there. Aspergillus, mostly the most important drug which is used is a voriconazole. Please learn about it. Mucor, it is amphotericin B. And mucormycosis, it is usually seen in diabetes or immunodiabetic patients or immunocompromised patients, and it invades the blood vessels. Vascular invasion is seen, and rhino-orbitocerebral form is the most common one. Next question, a TB patient on treatment develops tingling and paresthesia. Which vitamin deficiency is likely? So tingling, paresthesia are features of peripheral neuritis, and it is associated with vitamin E6 deficiency. Next question. Botox injections for wrinkles act by which mechanism? Answer is inhibits the acetylcholine release. So, botulinum toxin cleaves the snare proteins, permitting acetylcholine exocytosis at the neuromuscular junctions. It is used in wrinkles, blepharospasm, spasticity, hyperhidrosis, etc. And the toxicity case, there will be, in case of its toxicity, there will be respiratory paralysis. Next question. Which drug is a PCSK9 inhibitor? Again, monoclonal antibody, mechanism of action, uses everything very, very important. So here the answer is evolocumab. Next question. An elderly man with rigidity, tremors, and blank facial expressions needs treatment. Which drug is appropriate to manage his condition? Answer is sertraline. So, anti-Parkinsonism drugs as well. Please have a look at them about the COMT inhibitors, MAVO inhibitors, everything, MAVO-B inhibitors, everything. Like, just have an idea about them and about the Parkinson, even from other subjects, like even from physiology point of view, anatomy, everywhere, like Parkinsonism and even the cross sections of basal gang, everything is very, very important. Please have a look at the Parkinson treatment and the drugs, and from the pharmacology point of view. Next, 2023 PYQs. A bronchial asthma patient on inhalational steroids presents with white patchy lesions on the tongue and buccal mucosa. What is the drug that can be used to treat this condition? Answer is clotrimazole. So, oral candidiasis, a common side effect due to steroid deposition in the oropharyngeal space. And clotrimazole, it is a topical imidazole antifungal effective for oral candidiasis. It is administered as a 10 mg trochet dissolved in the mouth 3 to 4 times daily, or as a lotion or gel swirled in the mouth. Side effects are like small ones like local irritation, burning, etc. Next, a pregnant woman with a history of bronchial asthma is in the 3rd stage of labor. Which drug should be avoided in the management of postpartum hemorrhage in this patient? Answer is carboprost, which is a prostaglandin F2 analog. It is has a high risk of causing bronchoconstriction. Since the patient is having asthma, we avoid this drug. Next question. Name the drug that acts on both neutral endopeptidase and angiotensin converting enzyme. Answer is omapatrilat. It's an image-based question. Very, very important. These kind of questions nowadays, they are coming like very, very important question. And please at least try to learn the answer. Like, it's a PYQ, can directly learn the answer at least minimum, because very, very important. Recently they're asking questions related to all these kind of topics. Next, a patient with a previous history of MI and ventricular arrhythmia is on treatment for few months. He developed fatigue, dyspnea and weight gain. He also has developed pulmonary fibrosis. Which drug is responsible for the above mentioned side effects? Answer is abiraterone, which is known for its serious side effects like pulmonary fibrosis, hypothyroidism or hyperthyroidism, hepatotoxicity, corneal microdeposits and neuropathies. Next question. A young female comes to emergency department after consuming 100 tablets of aspirin. What should be the next step in the management? Answer is give sodium bicarbonate to alkalize the urine, because aspirin overdose requires urine alkalization to enhance the excretion of this drug by ion trapping. Next question. A chronic smoker was on nicotine replacement therapy and clonidine tablets for smoking de-addiction. He stopped taking clonidine and now presents with a headache. What is the reason behind this? Answer is rebound hypertension. This again is a PYQ, because clonidine is an alpha-2 receptor agonist. It causes rebound hypertension when it is stopped, leading to headache. Next question. A patient with recurrent attacks of gout was started on therapy that inhibits the synthesis of uric acid. Symptoms were reduced after therapy. Which drug was he started on? Answer is allopurinol. A drug that inhibits uric acid synthesis for gout is allopurinol. It is a purine antimetabolite. Competitively inhibits the xanthine oxidase and reduces the uric acid levels. It is used in gout and hyperuricemia in malignancies. Next question. A patient with malignancy is undergoing chemotherapy. The platelet counts were reduced after the previous cycle of chemo. Which of the following drug can be used in the treatment? Answer is oprelvecin. Chemotherapy-induced thrombocytopenia requires a drug to increase the platelet production, and it is caused by oprelvecin. It is an interleukin-11 analog, stimulates thrombopoiesis, and so used in thrombocytopenia in non-myeloid malignancies. So all these drugs, even filgrastim, amifostine, all these are very, very important. Please look upon them as well, because they are potential questions which can come up in the next NEETPG. Next, a true statement among the following is losartan acts as a thromboxane A2 antagonist and inhibits the platelet aggregation, because losartan is an ARB and it competitively antagonizes the AT1 receptors and the thromboxane A2 receptors, reducing the platelet aggregation. It's used for hypertension. It is safe for hyperuricemia patients. Next, a patient given digoxin started having side effects like nausea and vomiting, and the serum concentration of digoxin was 4 mg per deciliter. Plasma therapeutic range is 1 mg per deciliter. Half-life is also given as 40 hours. How long should one wait before resuming the treatment? So you need to know the formula to calculate this, and it can also be calculated with basic understanding about the question. Like if you have if you are putting a little effort into this question, you can find this answer. So after 40 hours, the concentration will halve to 2 mg per deciliter. Since the half-life given is 40 hours. Then after next 40 hours, that is after a total of 80 hours, it halves to 1 mg per deciliter, and within the therapeutic range. So total 80 hours will be taken to reach 1 mg per deciliter. Next, a patient comes to casualty with organophosphate poisoning. He was started on atropine infusion and pralidoxim. After 2 hours, the patient had a sudden rise in temperature. What is the likely cause of fever? So here atropine is the culprit, because after usage of atropine in high doses can lead to fever and confusion, mydriasis, flush face, and dry secretions. And organophosphate toxicity, its management is very important topic. Please learn about it. Next, the mechanism of action of tissue plasminogen activator is answer, enhance the fibrin degradation, because tissue plasminogen activator, it enhances plasminogen to plasmin, enhancing the fibrin degradation, that is fibrinolysis, to break down thrombi. So that's it guys for the 2023, 2022 and 2021 PYQs of pharmacology, and my book is also available guys, fully prepared with the explanations and the all the PYQs of the 7 years, and it has taken a lot of effort from my side between my duty days and other things to prepare this book. Every free time I have put into that book and try to make this one. So guys, if you are interested in buying the PDF, the book, then you can contact me on Telegram. It will be really helpful for you for your last minute revision for NEETPG, because you can just glimpse through the answers. And yes, as I've told, it has taken a lot effort from my side. So that's it guys. Support my channel, support my book, and if you have any other suggestions, please do mention it. So till I come back with my new video, stay tuned. Till then, bye.